Hey everybody, welcome to our guest lecture series. My name is Logan, teaching Exercise Science 101, and I have one of our first guests with us, and he's going to talk to us about musculoskeletal rehab and some of his experiences within that line of work. So Avante, I'll let you go ahead and introduce yourself.
Hello, my name is Avante Gibson, like Mr. Daughtry said. I am originally from the Bahamas. I came to the U.S. a few years ago. I went to school at Queen's University of Charlotte, got my bachelor's degree there in exercise science. And then from there I went on to University of North Carolina at Charlotte and got my master's in kinesiology with a concentration in clinical exercise physiology.
Great. So one of the first things that I'm going to ask Avante is, Avante, how did you gain kind of an interest in exercise physiology, and what made you want to go the clinical side of things rather than, say, maybe strength and conditioning or health promotion?
Oh, good question, man. I'd say it started off, I was really into sports at a young age. And then from there, I did some sports in college. I was a competitive swimmer back in undergrad. And then from there, I'd say the biggest influence was my internships. So from there, I sort of was able to go out to some of the clinics and hospitals in the greater area of Charlotte, sort of like Novant, Atrium. I was able to just see the populations from cancer to cardio to pulmonary, and it really sort of connected with me, just being able to just work with said population and see the progression that they were just going through. And I felt like hey, I can definitely make an impact on the individuals that were in these populations.
Right. So it was really more so some of the internships that were set up by your college, and after you were exposed to your clientele in the population, that's where your passion started for
Yes.
this type of clientele
Definitely.
that you work with.
I want to say the internships were definitely a significant factor towards sort of leading me in the direction where I am today.
So when you say internship, were these like 400-hour internships that were in your undergraduate, or are you talking about your practical rotation within your master's degree?
I want to say a combination of both. Started off, like I said, exercise science undergrad. I started off, I want to say either sophomore, junior year. Started taking a couple of internship courses, and then from there I was out and about into various clinics and hospitals, and then even park and recreational. What's it called again?
Park and recreation. What do you mean?
So we might have to take this one out.
Definitely.
But from those experiences, I want to say it just sort of built upon that. And then during grad school, it was a little bit more focused, a little bit more concentrated. We had a little bit more hands-on per se, and more responsibility. And as a result, I was able to work more with the patients.
Okay.
And that gave me just more satisfaction and sort of solidified just my overall idea of what I wanted to do.
Right. Okay. Well, that's great. So with that, what is your current career, and how long have you been doing it?
So I work in a neurological rehab center, and I've been doing that for a couple of years. I see individuals with spinal cord injuries, traumatic brain injuries, autoimmune diseases such as MS, cerebral palsy, spina bifida, etc. I've been doing this for a little over 2.5 years now.
Great. So when you say a neurological rehab center, I know you talked about some of the conditions that your clientele have, but what exactly are the conditioning status of these patients that you have, and how do you go about diagnosing some of these individuals? I know that with rehab we don't diagnose the condition, but are these patients that are referred, or are these patients that come on their own accord, and then it's up to us to kind of determine what the pathophysiology of the condition is?
Okay.
How does that work?
So, as far as individuals coming to us, it's a combination of both. They can be referred over to our organization, or they come on their own accord. That being said, they sort of come, they might have some form of idea of what their actual diagnosis is, but we sort of confirm it, per se. So for example, we have someone come in who's been, a serious accident and they're paralyzed. Okay, they come in and let's just say they're paralyzed from the neck down. Well, that's considered a quadriplegic. And a little specified, it depends on the break on their cervical spine. So if it's a quadriplegic, for example, they more than often had a break between C1 to C4. And from there, we pretty much take them through an eval, see what we can possibly do from them, and then on top of that, see what kind of goals they are trying to obtain while they're in our pretty much program. And from there, pretty much write a prescription for them, an exercise prescription that sort of focuses on their sort of strengths and weaknesses, just building them up, seeing how we can make them better, per se.
Right. So when you say we give them an exercise prescription, and with rehabilitation of these types of patients, everything is exercise based and everything is treatment modalities. There's not necessarily medical procedures being done, and it's not medication type prescriptions, but everything is exercise based, and we are attempting to improve their quality of life, improve their symptoms of pain, and help them return back to a more functional life. So in order to achieve that objective, what do you think what are some of your day-to-day responsibilities in terms of administration of the prescription and helping them, guiding them through some of these exercises?
Yes, of course. Like when they initially come in, we give them an eval, and then we sort of figure out their strengths and weaknesses. From there, we sort of create our own notes for them, to which we can use in building an exercise prescription and just a program for them. So when they come in, it's about an hour to 2 hour session depending on said individual. So for example, if it's an MS patient, we're only working for them for about an hour, just because you typically don't want to overexert MS patients. If we're working with an individual who's a quad, we'll typically want to see them for about 2 hours, just depending on what kind of exercise we do, and also just the transfers. We try to get them out of their seats, out of their chairs, as much as possible, and with that, the transfers just take some time naturally. But as we're writing actual programs, there's 4 things we highlight the most. It's range of motion, it's weight bearing, it's core, and then it's just cardio. Those are pretty much the 4, I'm going to say, pillars to our exercise prescription. So for example, with a quad, weight bearing is pretty much the most important thing, just because they're in their chairs pretty much 80% of the time, majority of their life. So trying to get them out of their chair and pretty much on their feet is a huge component towards their actual workout, per se, or rehab process. And then range of motion. Okay, so they can't actively move their limbs, so we got to help them do that. Okay, and if we don't, then there's an increased chance that their limbs become stiff and as a result, they're limited to certain movements. And then from that, strength and conditioning component. I mean, at the end of the day, yes, there are quads, but they can still feel the movement, and as a result, they can work to the best of their capabilities or what they have.
Right.
And let's say weight bearing, strength, core. Yeah, core. You always want to do core. Whether it's, like I said, quad, a para, a stroke or traumatic brain injury, core is always in that mixture. Okay. At the end of the day, like I said before, we're a neurological rehab center. Yes, those are the four main pillars. Yes, we want to get their body moving, and yes, we want to get them stronger and possibly being able to move said limbs again. But we're also training the nervous system. Okay, that's a main component towards what we try to accomplish. Just trying to find connections to neural pathways and just get the connection going from point A to point B again. I'm not gonna lie, it's not always possible just because of the nature of the injury, but at the end of the day, we still do what we can to make their quality of living better.
Right, and so at the end of the day, Avante is an exercise physiologist, and he's a rehab specialist. So with that job position in your neurological rehab center, what are the education requirements in order to have a position like yours, and what are the types of certifications that you have to have?
Yes, of course. I'll tell you what I have. I have a bachelor's degree in exercise science and a master's degree in kinesiology. I would say bachelor's degree is required, and master's degree is preferred, especially in the position I'm in. I have my certification in personal training, ACSM, and also my clinical exercise physiologist certification as well. Both of them are more so required.
So with those certifications, a certified exercise physiologist or a registered clinical exercise physiologist, those are both offered by the American College of Sports Medicine. The CEP exam, you have to have a minimum of a bachelor's degree. With the registered clinical exercise physiology exam, you have to have a minimum of a master's degree. That is subject to change, potentially within as little of a year. Those requirements may change, but typically depending on your core education, that determines what type of certification exam that you can sit for. So with neurological rehab, what do you think the job projection is over the next, say, 5 to 10 years? Is it subject to increase in popularity, or is there going to be a higher demand, or do you predict it stagnating or potentially decreasing in demand?
I would say it's going to increase in just demand and also popularity, especially in the great area of Charlotte. I mean, Charlotte's growing like fast, vastly fast, and with that, it's going to require more jobs, and just the nature of the terrain of the field, the neuro world. I just feel as though we've seen a lot more demand upon neuro rehab specialists like myself.
Right. So the career field is subject to growth. There's a very high demand, and that's both a good thing and a bad thing. You don't want to see a ton of patients because that just means that more people are injured and need rehab, but it does give us job security.
I mean, yeah, it's sort of a win-lose situation. I mean, at the end of the day, yes, it gives me a job, but also that's someone who has suffered a traumatic injury. At the end of the day, like per se, I'll say this: these individuals, they come to you. Obviously, they were dealt a bad set of cards, a bad hand. It is my responsibility to show them that they can do and become much more than what they think they can. Okay, so yes, I do a lot with their actual bodies, but a huge component to that is also coaching them and just showing them, reminding them that hey, they're still someone who can do something in this world.
Right. Well, and that's great, and that's a perfect segue into my next question. What would you say the most rewarding aspect of your job is? I know that we're helping them improve their quality of life, but what would you think that you get the most fulfillment out of this?
I definitely just building the relationships that I have with the individuals that I meet. I'm not gonna lie, if you do decide to fall into this footpath or just go into the healthcare field, you're gonna meet a lot of different people. You're gonna see a lot of different faces. You're gonna just meet a lot of different characters and personalities. And yes, they're coming to you for service. They're coming to you to per se learn and grow when it comes to their bodies, physically and mentally. But at the same time, you can learn from them. I always find myself just learning from my patients. And I'll give you an example. It's right inside 2020. Year 2020, I had a patient, 16 years old, paralyzed from the waist down. At the end of the day, she's going through schooling during a pandemic. I don't know what that's like. I'm way past those years, but at the end of the day, she's telling me how she's experiencing a pandemic while also trying to get her education. So it's just stuff like that where I just find myself learning more about them and also just building relationships with the people that I see.
Well, that's great, and it's all about the relationship with your clientele and really just helping them in a place that they cannot help themselves. That's always a great aspect of being a rehab specialist, and that's one of the best parts of the job. So if you could give any advice to an undergraduate exercise science major right now, what would it be?
I would say take your internship seriously. I know sometimes you might think as though one of your internships isn't all that great or is not really beneficial to where you're trying to go or what you're trying to do with your career, but that's not true. Okay? Every internship, I feel as though you can get something in return, whether it be experience, connections, networking, or just meeting new people, and just like I said, building relationships in that way. Okay, always, I just definitely take your internship seriously. Definitely just try to soak as much information as you can from those, because experience is pretty much the best way to gain knowledge.
Well, you heard it here first from the man himself. He said, take your internship seriously. It will help you a lot when it comes time to get a career and with networking. And my advice to you would be to keep an open mind with your education. I thought I wanted to be a biologist in my undergraduate, and now I'm an educator. So you never know what types of interests you may end up having. But thank you, Avante, for coming on and being one of our guest lecturers for our 101 class. Again, his name is Avante Gibson. He's in neurological rehab, works in the Charlotte area, and he would love to answer any follow-up questions that you might have.
Of course, it's been a pleasure.